Because the hair from the donor site is not as responsive to DHT, it is expected that a hair transplant is permanent. This does not necessarily mean, however, that the patient will not continue balding from the original hairs that are still on their scalp. So it's really important to have long-lasting permanent results, but the patients also do a lot of good maintenance after the procedure. And this is going to include having PRP injections or possibly going on a lifelong prescription of finasteride or Propecia or maybe even Rogaine. The best time to get a hair transplant is when you notice that you have thinning or balding of the hair. You also want to be ideally done with as much thinning or balding as possible to avoid needing multiple procedures in the future. So the best candidates are usually in their mid to late 30s who have stable hairlines. It's never really too late to get a hair transplant, but you do want to make sure that you have a good amount of healthy donor hair available to adequately cover the areas that you want treated.